This home is in North St. Louis City, zip code 113. This home is in St. Louis County, actually Clayton, Missouri, 63105. What is the difference in life expectancy between these two homes, separated by no more than 2 or 3 miles? There's a big difference. We want to talk about why some neighborhoods are less healthy than others. Some neighborhoods have been under-resourced for decades. In a setting of residential segregation, there's a disinvestment in educational opportunities, a disinvestment in stable housing, and a disinvestment in the infrastructure surrounding those neighborhoods. As a consequence, you have unstable neighborhoods. Unstable neighborhoods lead to unhealthy neighborhoods and unhealthy individuals. Because of all these factors, it's really incumbent upon us to delve deep into this history, to recognize that in order to understand health disparities in communities of color, we must get out of our comfort zone, we must get civically engaged, and we have to have a greater sense of how do we train ourselves to mitigate the bias that we all have and to become more aware of these disparities. How do we incorporate questions on social determinants of health in our medical histories? And how do we recognize that individuals who are living in these certain zip codes, North St. Louis, who live under daily trauma and high stress, how do we begin to deliver care that asks, what happened to you rather than what's wrong? How do we deliver trauma-informed care? These are things that we must do now. We have to do if we really are sincere about wanting to reduce disparities and ensure that every St. Louisan has the opportunity to reach their full health potential.